have you ever been admitted to a psychiatric hospital? Have you ever been on a 5150? Yes or no? But sometimes it's, well, I was taken to the hospital, I was assessed, but I wasn't kept on a hold, or they didn't keep me overnight. Those are things to assess for, because it's not just hospitalizations we want to tease out, it's also like ER visits for panic attacks or suicidal thoughts. Even if they didn't meet criteria for a 5150, it's still relevant and important to kind of assess for any warranted concerns that led them to seek emergency assistance. Okay. If they have been in the hospital, it's usually a good idea to get the dates, right? The dates, times of visits, which hospitals they went to, and then how much insight they have as to why they were there, as well as what followed up, with in terms of their stay there. Were they discharged with medication? How much medication? What kind of medication? Were they? Did they have blood work done? If they have their blood work labs, that's really important. And then if they're open to it, you can always get a release from from the client for the hospital, and then request the hospital records. And so that can be very telling, as well as discharge summaries, lab results, that kind of stuff. Tox screens can all be very relevant, especially if you're working in coordination with a psychiatrist who's going to want to know those things anyway, because psychiatrists will often order their own blood work, and if they have labs on file somewhere, especially recently, it's a good idea to have those.